You're watching this mega coverage on ET Now, the Times Fact Report, where we are talking about, and tracking the COVID-19 pandemic with data, with research, and talking about when we can see this petering out. These are projections based on 6 different kinds of surveys, an average of them. And one very important aspect of these projections is the medical infrastructure we need. Now, as more and more people possibly will be infected by COVID-19 even after the 3rd of May, the question will be, do we have the infrastructure to treat everyone the way they need to be? That will be essential even in reducing mortality rates from where they are. So just a few figures for you. Out of the total beds of India, already 40 to 45% are occupied. As per the survey, only 78 people will have ICU beds for every 1 million of the susceptible population. How do we increase, how do we scale this up very, very quickly is the question. And to speak on this aspect, we have with us now Dr. S Narayani, Zonal Director of Fortis Hospitals, and Dr. Praveen Gedam, Additional CEO of Ayushman Bharat. Remember, under the Ayushman Bharat scheme, COVID-19 treatment is now free for the percentage of the population that is eligible for this scheme. They also are impaneling private hospitals for the same. Welcome to both of you. Dr. Narayani, I want to just begin, with your first take on some of the findings of our survey, which point to an acute shortage of beds in ICU and equipment if we reach our peak.
So I have this to say that I see your survey and see your numbers. But I think the issue is really not that serious, and I don't think we're going to have such a shortage of ICU beds. I think I would put it in perspective by saying that, first of all, we need to remember that only about 15 to 20% of those patients who test positive really need a critical care bed, number one. And number two, we do have the kind of critical care beds to cater to them. Probably what we have is that these are in multiple segments and they are fragmented and spread across multiple hospitals rather than having it all together in one place. So that, to my mind, there are beds available. Secondly, every day the situation is dynamic and there is a lot of activity which is going on by various health authorities and the doctor groups coming together to redefine who are the patients who need to be in an ICU bed in a hospital. And so they are vacating these beds with newer protocols. They are moving patients around faster and keeping patients who don't need a critical care bed being moved out faster. So to my mind, the situation is not so bleak.
Okay. I'm coming to you in a second, Praveen, with my next question, but just a follow-up question, Dr. Narayani. If one goes by global experience, there has been a shortage. I understand the virus right now it has not spread like what it has done in Europe and US. But when you say confidently that there is no shortage of ICU beds, are you speaking about your experience at Fortis or what private hospitals have, or that was a comment based on our total availability on all India basis?
So I'm more specifically speaking about Mumbai. So I'm working out of Mumbai. I'm not speaking just for Fortis. And if we see in the city of Mumbai, the health agencies are working as a public-private partnership where the private hospitals are working along with the public hospitals. And the way things are moving, there is, I think I would say the experience is that more and more beds are being put into commission, number one. So the beds are there is a pipeline of beds which is getting available. And additionally, there is also the guidelines which say whether a patient needs to be in a critical care bed is constantly being looked at with better treatment protocols coming up, which vacates the bed a patient is occupying faster. So in that sense, I would say that the number of patients who the critical care beds would be available. And we must keep in mind when we look at the data that in countries abroad, there is this factor of the demographic age group of the patients, as a result of which there are more number of patients in the older age group, So your more critically affected patients are much higher than what would be the case in India.
You know, there was a report just a couple of days ago of a COVID-19 patient, a woman who had to wait 30 hours in a parking lot of a Mumbai hospital just to get admitted in. Part of that report, of course, talked about the lack of coordination of the local authorities to where the beds were actually available. Let me take the question to Dr. Praveen from a pan-India perspective, and especially outside metro cities. The situation is such that there are more beds available in cities where the number of cases are higher, but the moment you go out and you go to tier 2, tier 3 cities, rural areas, the medical facilities start thinning out. How are we preparing to have people treated in these areas if the situation so emerges?
Okay. Firstly, I just like to clarify that I'm not gone through the report which you are just referring to, but yes, coming to the point of availability of infrastructure as a whole for patients from metros to countryside, especially particularly 2 and 3, the general trend has been to take care of the patients in government facilities spread all over. Mostly it is district hospitals, civil hospitals, or local medical colleges of the government. And as of now, the government has been managing it well. Now, I hope it doesn't, the situation doesn't arise. But let us presume if things go very bad, which it should not, I hope. We in government have a backup plan ready to use the facilities available in Ayushman Bharat. Now, Ayushman Bharat itself has a network of 21,000 hospitals, which is a big number, out of which 9,000 are private hospitals. So there are two ways by which this can be done. When we are talking about availability of beds for COVID cases, you may remember that now we are treating patients either in the hospitals are getting converted into COVID hospitals. So generally COVID is being treated separately in a separate hospital or a separate block. This may lead to a situation where non-COVID patients may also find it slightly difficult. So this Ayushman Bharat can chip in by providing an alternative facility free of cost to COVID as well as non-COVID patients. This will further augment the availability of beds or infrastructure in general, which in fact right now appears to be sufficient one.
Dr. Praveen, just a follow-up question in terms of equipment as well. The world over, we are seeing COVID-19 patients and some of the extreme ones needing a larger number of ventilators, dialysis machines in some cases. And we know that the private sector is also now coming up with ways to create ventilators faster at cheaper cost. But what about the time lag between the number of cases bunching up and all of this equipment becoming available? Is that an area of concern?
It is exactly this reason that we are right now in a lockdown to suppress or flatten that curve so that this bunching up doesn't happen. This bunching up has happened in many developed countries with far better medical healthcare infrastructure than India and has led to certain crises. And India has been managing it from not only clinical point of view to treat the patient per se, but from public health point of view and preventive health point of view by ensuring that the cases are spread over time, temporal distribution. So this is one strategy which India has been following successfully so far, better than many other countries. This is one. Part two, at the same time, government has invoked special provisions of acquiring medical or procuring medical equipments in a fast track mode, bypassing the routine processes which are time consuming. And I hope industry is also trying its best to match with the adequate supply. As of now, this has not happened, and I think the planning is like that, and also hope that this situation doesn't arise.
Okay, I want to go back to the earlier part of the report. The report is projecting that we may be peaking in mid of May, and perhaps later in some states like Maharashtra, Tamil Nadu and some northern states where according to the average modeling what Praveen has done, we've not really peaked out. But it is on you viewers, if you maintain social distancing, if you really respect the importance of this lockdown. I know it's hard, but it's important to maintain discipline. We at ET Now tell you how to convert your pennies into pounds. And this is a time when right now it is important to be safe and stay safe. Stock markets, yes, they may have fallen. Yes, economy will take a hit. Yes, corporate profit will take a hit. But the most critical thing in life is to stay alive. And social distancing is something which really has worked. I'm going to get the projections once again, but Dr. Narayani, I'm going to get a closing comment from you. As a doctor, why don't you re-emphasize the importance of social distancing? I'm sure right now you're dealing with people who are coming to you who may be psychologically devastated, who may not understand the importance of social distancing. Do you think lockdown, stroke social distancing so far is the only way out? Yes, we'll discover vaccine one day, we are hoping and praying, but today it's not been discovered.
Absolutely. Social distancing is the key. No panic is a second factor. While we understand social distancing, I think we must look at it with complete the logic behind why we're doing social distancing. There is an element of panic which is creeping in, making people feel that there is a stigma attached to this whole getting a COVID positive tag onto you. I think that too needs to go away. Entire society as well as individuals need to feel that it is like picking up any other infection. You just need to make sure that you keep your distance so that you don't contribute to the spread. So in addition to reinforcing your message about social distancing, I would like to say that there shouldn't be a stigma around being testing positive. People should come up voluntarily, and when they feel that there is a doubt in their minds that they could be COVID positive or they have some symptoms, they should come up, and this will largely and hugely contribute to quickly picking up cases and controlling the contacts and controlling the spread.
Dr. Praveen, hypothetically, if you look at the numbers here, how many hospital beds as we speak today are ready? How many beds currently have provisioning of a ventilator? And how many of these beds right now are ready to operate as we go live on national television? Dr. Praveen?
So this information imperfectly is not available with me right now, though it's with me in my laptop. But we have gone through that a few days ago, and as of now things are okay. We have enough beds in India, one. Two, as I told, we have a backup plan of roping in private hospitals in a big way ready. So this is a backup plan which will kick in when we run out of the capacities in public health care infrastructure.
Okay. Dr. Narayani, if I may come to you on the scenario post 3rd of May. Now, what part of this report predicts is what happens once the lockdown starts to lift. And the concern is, and the challenge really is, to make sure we don't suddenly have a jump up of cases. It's a fine balancing act because you can't stay in lockdown forever in all districts of the country, but the moment you move out, the risks go up. What are the kind of challenges the medical fraternity and the medical infrastructure in the country now have to be prepared for as we see a scenario develop post the 3rd of May, where there may be a partial lift in certain districts and as a consequence of that, an increase of cases?
Yeah, you're right. So we can't, post the 3rd of May, we can't suddenly feel that it's all back to normal and lockdown goes away and people rush into get back to normalcy in terms of life, there is, yes, has to be a high alert. And I am hoping that the lockdown and the changes in the social distancing will kind of go away only in phases. And I'm sure there would be measures to do a staged removal of the lockdown. The aspects of social distancing should continue. And I would also say that as, say, a medical practitioner and as hospitals, we will maintain a high level of suspicion and high level of our index of suspicion on who could still be a possible positive case would be high, and we would be screening for the same. Additionally, I would say that by then I hope we would have newer tests which help us to more rapidly pick up whether somebody has had an exposure or not. And we would also keep in mind that the number of asymptomatic positive cases may be walking into us. So some of the precautions, some of the measured way in which we have flow of patients, we would definitely continue. It's not as if we could stop some of these activities by the 3rd of May. And it will take us a while before we completely say that we can go back to normal. And so it's going to be in a staged manner that we come back to normalcy.
Dr. Praveen, I think one big lesson that people are talking about with COVID-19 the world over, not just in India, but in the Indian context, is that have we been paying less attention or neglecting the medical infrastructure in the country? And here is where, a scheme like Ayushman Bharat comes in. Fantastic, ambitious scheme about providing universal health care. But for that, the underlying medical infrastructure needs to be in place. What are the biggest lessons and takeaways from here on for public health?
Okay, this is a sort of actually calamity which has fallen on the world, and it has a lot of lessons for everybody dealing in the public health to learn. And the situation is evolving day by day. Experts are giving their advices, and things are keeping under control. Yes, so I would like to say that we should keep our plan of action to respond to any public health emergencies with very, very clear SOPs ready, which I think we already have. The lesson is to basically fine-tune them further, improvise them further, which we are already doing. So that any such emergency, which if it comes in future, we can deal it in even better way.
Let me take that question to Dr. Narayani as well. The big lessons for India on public health management from here. We seem to have an over-dependence on, private health facilitators. They are bunched up and concentrated in the big cities. Does this now give us a cue to re-look at the entire medical infrastructure across the country?
I definitely feel we need to take a look at the medical infrastructure across the country. And what I would like to say is that, this has been something quite a bolt from the blue. And it's even in the best of countries which have advanced countries which have got very good medical infrastructure have actually found it difficult to grapple with this condition. And in some ways, I would say that India has actually done better than some of the advanced countries as well. However, yes, post this, there would be a need to go back and look into our own medical infrastructure. We should also look at it from the point of view of in such, these infectious disease outbreaks. How well are we prepared to handle such pandemics? And is there an opportunity for us to do it in a single place where you have a, kind of protocol where the entire system gears up and has a machinery to work it out of one central place, which could have helped us handle this whole situation faster. While we are seeing all of this, I would like to make a mention that this is a situation which is unprecedented, which is happening has taken us completely by surprise. But one of the ways, as one person who's a part of the team which is working on this, I definitely want to mention that in spite of it being a very challenging situation, the one unifying factor which I see in the response is both public and private working together, number one. Number two, more importantly, you asked me right in the beginning about the shortage of ICU beds and everything. A very fantastic thing which is happening is the clinicians across are talking to each other. The intensivists are talking to each other every day. They are comparing notes. This kind of coming together, which has happened to find out what is the best treatment available and how to turn patients around, is phenomenal. And I also want to mention that actually we've been brought together by the health authorities, by the municipal commissioner and his team, by the newly formed strategic group. They brought us together where we are working as one continuum, and with whatever resources we have, all kinds of patients we are able to manage, and every day we are learning, every day we are improving, every day we are coming up with a change in a protocol which addresses the new challenges of the day. So while I'm sure there is a lot we need to learn from this, even as we are going through this, as we are evolving, I think every day there's some very good learning experience, and rapidly being on our feet and facing the next day with more improved protocols is already happening, which is absolutely amazing.
Okay, I'm going to go back to the impact of the lockdown on our GDP. Basic maths as to which are the large states which currently have not peaked out according to this report, and if they've not peaked out, what is the total contribution coming from the state where we currently live, which is Maharashtra, large states like Tamil Nadu, important states in north like Delhi, Haryana, Punjab. These are large contributors to the aggregate GDP of India. Maharashtra's contribution to India's GDP is north of 10%. Tamil Nadu's contribution to India's GDP is about 10%. These are factors which we may want to bring out for IT Now viewers, that the lockdown is coming at a cost. But I go back to that point again, once again, Tamanna. Survival first, revival later. As business journalists, I know it's very hard for us because we right now, along with reporting a medical crisis, we are also reporting a very gloomy picture of the economy, and the economy has taken a knock, it has taken a tumble. It's going to be a tough year after a tough 2019, and we may not get back to stock market highs. A lot of wealth destruction has happened, market cap has got destroyed, some industries will see job losses. It's hard, Tamanna. But I go back to that same point once again. It is important to survive. It is important to stay alive. And survival first, revival later on. And the world is in a mess, Tamanna. So on a relative basis, given what's happened to oil, given that we still have monetary ammunition to bring interest rates down, we still have a huge inherent advantage that medically, unlike other countries, we are still in a safe zone. So these are long-term factors which will differentiate us, again, on a relative basis, on an absolute basis. But economy is really bearing the brunt of this lockdown because it has never happened before, and something which has never happened before, sometimes you don't know what mathematical model will apply. But I go back to that point again, social distancing matters, and the fact that today we are feeling happy, we're not celebrating, but we are feeling happy that our numbers have not gone up, is because of lockdown.
No, absolutely, Nikunj, you have a very good point there. But it's a tricky balance that policymakers are looking at right now, because you don't want the cure to be more deadly than the disease, and an extended lockdown will have to be balanced with some kind of economic support. We saw the RBI coming in, with a second set of measures in the last month and a half today, exactly for that reason. You will have to keep thriving, surviving, and have an exit plan as well, because the economic hit is hard for companies, for those who will get laid off, for migrant workers, for your daily wage laborers. So very tricky and fine balance there. I want to take a very short break at this time. Of course, thank Dr. Narayani and Dr. Praveen for their excellent analysis. But I want to tell our viewers to please come back, because when we return, we're talking about essential supplies. We're talking about the companies and the kind of companies needed to fuel our consumption and our needs. We're going to be speaking to Parle, we're going to be speaking to Amul after this very short break and looking at the impact of the lockdown on essential supplies. Please don't go away.